Our estimates show that 20 to 30% of the general population have mental health problems. We have realized that actually there is comorbidity. If somebody is abusing alcohol, there is gender-based violence in the home, there is depression creeps in, there is also anxiety. When that situation is happening, there is need for treatment, of course.
So CETA stands for Common Element Treatment Approach. It's an intervention that we use for common mental health problems such as trauma, substance use, depression, and behavior problems.
So we start off with a baseline assessment which tells us what symptoms our clients have before the CETA intervention. We do more post-assessments, which then allows us to compare how our clients are doing before the CETA intervention and afterwards. So monitoring and evaluation is important because it's able to give us this data that we can then use to confidently say that CETA is helping the clients.
It's really good, positive results we've seen, and they have very lasting positive impacts on the vulnerable kids especially.
It's an approach where we can train one provider to treat many different problems. And so that can really help with scale up and sustainability.
So we use an apprenticeship model of training when we work with lay providers. We're teaching a very set range of skills that will address the 5 most common mental health problems in children and 4 most common mental health problems in adults. So for depression, they learn a component called getting active, which is behavioral activation therapy. So for trauma, they learn how to do imaginal exposure, which is really just talking about the difficult memory that a client's been through.
We have an element called thinking in a different way. And that talks about the relation between what we think, how we feel, and how we act. And this is a skill that's even taught in leadership seminars, with CEOs. It can be really used with anyone.
At the end of it all, they become confident and they can actually treat clients with substance use problems, trauma, and depression.
Ultimately, we would hope that if CETA could be scaled up and sustained in multiple low and middle income countries, the treatment gap would decrease, that more people who were in need of mental health services would be treated, and they would really contribute to the economy, be healthier functioning, have better relationships.
So Zambia has successfully conducted pilot studies on CETA, and we've proven that it works. The government now has the mandate to consume the evidence that is coming out of the CETA program. Ultimately, we want to be at the hub or the center of excellence for CETA.